You've talked about cervical dizziness.
We could have a little look about that, yes. The trouble with cervical dizziness is there's no reliably good definitive test for diagnosing cervical dizziness.
Okay.
And I would say you cannot, because you cannot, in fact, in practice, separate vestibular from cervical inputs because they go together throughout the nervous system. So your dorsal ramia from your C2, 3 and upwards goes into the vestibular nuclei along with the vestibular inputs.
Yep.
Therefore, how can you separate them? And as far as the brain is concerned, at the level of the vestibular nuclei, which is where the brain does all its deciding, its outputs, it's just an electrical impulse. So you can't really tell the difference. So what I think is much more useful is to think about which is the main component. Is there a bigger component of cervical today, or is there a bigger component of vestibular? So is it more to do with neck tension, neck movement, or head movement? And that's probably the best way of thinking about it. There's one reasonable test we can do, which we can bring a swivelly chair in to use. So, Mark, if you were to perhaps sit on the chair facing me, we can do something called a smooth pursuit neck torsion test. And the thing with cervical dizziness is you cannot diagnose cervical dizziness by looking at the neck, because you fundamentally can't tell the difference between someone with a bad neck and someone with a bad neck who's dizzy. There is no difference at the neck. So you cannot diagnose cervical dizziness at the neck, which is a little bit paradoxical for us manual therapists.
Yes, yeah.
So we have to look away from the neck, and we can do that by looking at smooth pursuits. So we compare smooth pursuit with the neck in neutral, and we're looking at the quality of smooth pursuit with the neck in neutral, and does it produce a symptom? It's all about symptom response. And we compare that to a smooth pursuit in neck torsion. So now if you rotate your whole body, but keep looking at me, so now we've got neck torsion 45 degrees, and we'll repeat smooth pursuit. And is there a difference in quality of eye movement, as in are they more jumpy, and or does it bring on a symptom? And repeat that in the opposite neck torsion. So same thing here. Now this test has been validated, so it's effective for a whiplash population, but not a normal mechanical neck pain population. But that was with using the computerized oculography. So we don't have that in clinics. We just eyeball it, but it's still clinically useful as an eyeball test.